The postpartum period is often called the fourth trimester, and rightly so. It's a time of massive change for both mom and the baby. Physical recovery, hormones, feeding, anxieties, and sleepless nights all collide in a new normal that can feel overwhelming, but knowing what to expect and creating a solid support system in advance can make it a lot easier. Welcome to A Healthy Dose. I'm Julie Stautland, and today I'm joined once again by registered midwife Justine Schilstra. Justine has attended more than 350 births, and she's here to help us unpack the third stage of our series, What to Expect Postpartum. Okay, so here we go, the last stage. We talked about, on the other segment, about hand expression for breastfeeding and how it impacts milk supply in those early days. Let's talk about that again, just to bring us up to speed.
Yeah, so just to reinforce that, the research is really clear that when our body is told, my baby's here and I need to produce milk, when that can happen in pregnancy, so with some antenatal hand expression, like at night for 20, 30 minutes and collecting what you're able to, and using that in the immediate postpartum as well. So either a baby or a hand is telling the body, telling the breast, my baby's here, I need to produce.
And there's also pumps that, like, I don't know anything about that, but are there great ones to choose from? Or?
Yeah, so you know what, we would say at the beginning, you don't need to be using a pump for colostrum, because the colostrum is stickier and not as watery, so it doesn't travel through a pump very well.
Makes
sense. The hand works well for the first bit, and then after that, there's probably lots of great pumps out there. If you're going to be pumping a lot and regularly, let's say you have a baby in the NICU who needs your pumped milk, a double is great for your time management, so if you can do both at the same time. But generally speaking, women don't need to be pumping all the time after every feed. If you've brought in milk and your baby's doing a good job, we can actually produce too much milk.
Really?
Then you're dealing with an oversupply where you get reliant on the pump because it's all about supply and demand. So what we take out, our body will get used to replacing.
Interesting. Okay. Anything else a mom can do to increase supply? Like you said, the pump, obviously, if you say you can produce too much, but what if there's a person that really seems to be having a hard time coming up with an adequate amount and they have to do both breasts every single time and they're still not getting enough?
Yeah, that can be really discouraging for people. So first you want to make sure that there's not a hormonal reason for it. So thinking about the thyroid, for example, so seeing someone who can check those levels for you and see if there's an obvious reason you're not producing enough milk. But if we don't see an obvious reason and we're kind of still short, we do have some different supplements that we can use. Blessed thistle, fenugreek, moringa, those are all good supplements to add in, and your midwife can help you with the dosing of those. Okay,
good to know. How's the transition from colostrum to milk happen, and what triggers it?
Yeah, so as the placenta has left the body, that hormonal just elimination of some of those placental hormones does signal milk to be coming in. And it's twofold. It's the hormones of the pregnancy dropping off, and it's also the stimulation of the breast. So those two things where you're either pumping, like I said, pump, hand, or baby, stimulating your breast 8 to 12 times in 24 hours. And those night feeds are particularly important. So it can be tempting to, do a bottle and sleep longer. But if you are mentally able to get up and get through those first couple days, they're very crucial to your long-term milk supply.
Okay, so if you want to be able to supply enough for you, that in the beginning is really important.
Absolutely. I can't stress that enough.
Okay. So what are some common latching issues parents face, and how can a lactation consultant help?
Yeah, so sometimes we have just a very shallow latch for one reason or another. We know that a tighter tongue and a tighter lip can impact those. So those are things we check on.
And they call it tongue tie?
Yep, that's right. So a tongue tie, it means underneath the tongue, there's kind of a tighter tissue that's impacting the tongue from either lifting up to the roof of the mouth or sticking out of the mouth, or both. And then the lip tie would be the upper lip, not really being able to flip up nicely, so it's being held taut as well. And those definitely impact our latch.
Okay, all right. Well, We have more to talk about, so stay with us. Up next, we'll talk about baby's growth, sleep schedules, and what's really normal when it comes to our emotional states. Stay with us. Welcome back. I'm here with registered midwife Justine Schilstra discussing what to expect in the first few days or weeks with your newborn. So let's talk about nipple shields and creams when it comes to breastfeeding. Are they helpful? What do they do?
Yeah. So those are things that we would introduce in the event that we're having a bit of trouble.
Okay.
So there are creams that can help with if we've had damage done to the nipple. And just because you're feeding so frequently, it can be hard to heal. And we know that now we're leaking milk and then the skin's in a moist environment and that can make it harder to heal. So there are nipple creams that can kind of help protect the skin.
Now, obviously, if you're using a cream, I know as a new mom, you'd be like, oh, is it okay for the baby? Have to clean it off every time?
You do not have to clean it off. It is okay for your baby to have. So you would put it on after a feed, let it absorb for those 2 to 3 hours before you feed again, and you don't need to wipe it off.
This is good to know. Okay, why do babies lose weight right after birth? And when should parents expect them to gain it back? And when does it go from normal to a concern?
Sure. So a baby's been fed a nice even amount through the umbilical cord for a long time.
Right.
And all of a sudden now they have to do it on their own.
Right.
So we expect some weight loss in the first 3 days. And as that transitions from colostrum to milk, and their size of their stomach is able to handle larger volumes, they will drop a bit of weight. So if we're in the 7 to 8%, up to there would be considered normal. As we get closer to 10%, we typically like to see them not go below that. And if we see a baby that has lost 10% or more in the first 3 days, we do introduce usually a supplementation of some kind, either pumped breast milk or formula, to help get them through that time until they're gaining again.
And is there a particular formula at that early stage that would be recommended over something maybe later when they're older?
Typically, we just recommend ready-made for the first 6 weeks. And then after that, if you're using formula, then you use a powder.
Okay. So on that note, if it's normal for babies to not sleep through the night,
yes,
should you wake a baby to feed them or let them sleep? Yeah. There's always this like, should we, everybody's got an opinion.
Yes. So my opinion on this is that we wake a baby at the beginning until they have lost weight and are back past birth weight. And the reason that my practice and many other people hold to that is if you have a baby that you believe is just peacefully sleeping, are they actually sleeping because their needs are all met, or are they sleeping because they're lethargic?
Right.
Because they're actually low on calories and they don't have the energy to wake up. And so we like to stay ahead of that train and to wake them every 3 hours at night and every 2 hours during the day for the first while until the milk comes in, until the volume increases, and we see that they're gaining weight nicely and past birth weight. And then we truly do say on demand. If your baby gives you a 4 or 5 hour stretch, great, you take it.
Yeah.
But typically in the first 7 to 14 days, we would encourage frequent waking.
Try to get that food in there.
Yeah.
Okay. So not sleeping through the night is tough.
It is.
I remember it is crazy, but it's also expected. So again, what is normal and when should parents be concerned?
So babies are going to have a period where they are fussy. A lot of the times it will be a similar time of day for each baby.
Oh, interesting.
Not every baby will go through this, but it can be really hard if your baby picks midnight to 4 a.m.
Oh, yes.
Yeah. And that's where, being a team, if you've tried to feed the baby and you know your baby's fed and they're just particularly fussy, that's a good time to use your partner to spend some time soothing the baby and catching as much sleep as you can with those naps. They do add up during the daytime. But yeah, we should expect to have disrupted sleep for the first while. And that's different for each baby. And I would say it depends on your tolerance as a parent. How are you doing with your sleep deprivation?
Right.
Because that is a slippery slope where insomnia kicks in.
Yeah.
And that's not a healthy place to be.
No. And as a type A person, it's not the time to get really obsessed with cleaning, like take that nap.
No, absolutely. Yeah. Your capacity will get there again. Right now, your capacity should be focused on feeding and sleeping.
Yes,
Mhm.
absolutely. All right. And so, how can parents tell the difference between a fussy baby and true colic? And I think we're just
Mhm.
going to touch on this because we've got 25 seconds
Sure.
to come back to it.
Yep. So a colicky baby, the definition would say you're crying for more than 3 hours a day, more than 3 times a week for more than 3 weeks. So it's a
Okay.
3-3-3, and it's an otherwise healthy baby. So there's not an obvious cause to it versus that normal witching hour, your baby's just cluster feeding. That's okay.
That's good information.
Mhm.
Okay, stay with us. Coming up, the recovery journey for new moms right after this. A significant part of the postpartum period is how a new mom recovers and adjusts to the changes, both physically and emotionally, in the midst of new demands, new schedules, new emotions, and a lot less sleep. And while it can be a lot, it's also beautiful and life changing in the best way possible. So, let's talk about that. You've had the baby, you're not sleeping, and how do we differentiate between true anxiety that may
Mhm.
be building for a mom and a mother's instinct when
Mhm.
she feels like something's off with her
Mhm.
baby?
Yeah. So I think some good questions to ask yourself is this rooted in any reality at all, right? Like,
Okay.
am I just worried about my baby's breathing because I'm worried, or am I actually seeing signs that my
Hmm.
baby's having trouble breathing? So asking yourself, like, is this realistic? Like, is it actually happening in front of me? How much sleep have I
I was
gotten?
going to say sleep has so much to do with it. You're like,
Yes, it
okay, am I
does.
a little
Yep.
delirious right now?
Yep. Am I fed? Have I
Mm.
had water? And have I had a nap? And am I still worried about this after I've had a good night?
And I
Is a
think
good
that's a big
question.
part too, is moms
Mhm.
are so focused on the baby that they many times you completely forget about feeding yourself
Mhm.
and all
Yep,
that.
totally. I recommend every time you sit down to nurse, make sure that water bottle's beside you. Think about what you want to eat.
That's good.
It's important that you take care of yourself.
You really have to be intentional.
Mhm.
Otherwise, you delirium. Okay, let's start with physical recovery and what can we expect? What's normal
Mhm.
in terms of postpartum bleeding
Mhm.
and how long does it usually last?
Mhm. So we would expect some heavier bleeding for sure for the first 7 days,
Okay.
of bright red, heavier period for
Mm-hmm.
most people. We expect some degree of bleeding for up to 4 to 6 weeks.
Okay.
So a lot of times people will feel like it's totally dipped off around 2 weeks. And then there's another little surge that will happen of some fresh blood.
Interesting.
As that uterus really involutes is the word, where it goes
Mhm.
down deep into the pelvis, you can see kind of some fresh red blood again.
Mhm.
And then you have that spotting where it will kind of dwindle away by 6 weeks.
Okay. Can you explain postpartum cramps or
Mhm.
the after pains as many times they're called?
Yeah. So after pains are in the first 72 hours. They're typically the worst the closer you are to your delivery. And they get worse with the more babies that you have. And what's
I
happening
know.
is the oxytocin from that was giving you contractions. Every time we breastfeed, we get an oxytocin release.
Right.
So the oxytocin is still causing uterine contracting. And so you will have kind of mini cramps or mini contractions after birth in those first 72 hours until they kind of go away.
But it's beautiful how the body knows what it's doing. You're
Mm-hmm.
feeding your baby and
Yep,
it's also repairing your body and putting it back to
absolutely.
pre-pregnancy state.
Yep,
So it's so important. Those hormones are so
yes,
important, even though it's not pleasant to have
yes.
cramps, it's doing an important job.
Yes. And I would encourage anyone, let's say you're having trouble breastfeeding or you can't latch your baby right now,
Mhm.
that skin to skin can still facilitate that oxytocin release.
Which
Like
is
we
good to
know
know.
that women who cuddle their babies get
Yeah.
oxytocin release. So try not to, beat yourself up if you're not breastfeeding right now.
Yeah.
You can still help yourself to heal by skin to skin.
Important to know. All right. Many women are told to rebuild their core.
Hmm.
What's the safest way to do this?
Hmm.
And how can pelvic floor physio help with that?
So I would say if you have a large separation of your abdominal muscles, I would encourage you to see the right people for that, right? So there are pelvic floor and general physiotherapists who can help, but you really want to heal the deep core first. So our core has many layers. And so working on the deeper core first, there are exercises that facilitate that versus others that don't, and they do more of the superficial core. So seeing someone who can help you tune into that is important.
Like, do you know what kind of person you would talk to? Like a trainer,
Yeah,
or is it
so
a medical professor, a physio, or
a pelvic floor physiotherapist does also really specialize in
I was
that,
going to say
lower
very
abdomen.
special then.
Yes.
Wow. Okay. Okay. Hormonal changes can cause many things. Like, you spent 9 months, building up beautiful hair and everything's thriving, and then all of a sudden you're like, it's dropping all over the place.
Yes.
And you have other hormonal shifts. And what can women expect in those first few months after giving birth?
Yeah. So we do see that like sweating and night sweats in particular. So those hormones just throw off your temperature. So that's one that we see for sure. Just an increased thirst in general. So thirsty at the beginning.
Especially you're breastfeeding.
Yep, that's right.
Yeah.
And then sleep as well can sometimes be impacted by those things.
Okay. All right. When we come back, in our final segment, we'll talk about the emotional side of postpartum, mental health, anxiety, and learning to adjust. Postpartum mental health is a huge part of recovery for many new moms and their partner or family. So let's talk about what's normal and how to ensure you have the support you need. Okay, so before we get into that, I wanted to ask you about menstruation. Many people feel like, well, can you get pregnant or not get pregnant before that first period? Or does breastfeeding stop that from getting you don't get pregnant? What's the truth?
So the truth is, if you're breastfeeding, you will likely delay the beginning of ovulation.
Okay.
However, it's going to happen at some point.
Right.
And the order is that you're going to ovulate before you menstruate.
Exactly.
So it is possible to be pregnant, to be postpartum, and to get pregnant again before you have a first period. So
whether you're breastfeeding or not.
Whether you're
right?
breastfeeding or not, yeah. So if you're not breastfeeding, a lot of women will get a first menstruation again around 6 weeks.
Okay.
But the factor that we see is if you're breastfeeding frequently, so let's say you're up with your baby a lot through the night, you're more likely to delay your ovulation and menstruation. But there's obviously no guarantees. And so it's not a reliable form of birth control.
Don't use it as a form of birth control.
Yeah.
Right. Okay. Postpartum depression is becoming more commonly recognized and talked about, and that's a great thing. So, but what are some of the signs for women to know?
Yeah. So we have postpartum blues, which is perfectly normal. There's a big transition that has come. So some emotions in that regard of just some weepiness, some identity, like loss of identity and your new identity as a mom, those types of things. But we enter depression when it's persistent, so it's not improving as time passes, generally affecting your motivation, your joy, your contentment in caring for your baby, those types of symptoms.
Okay. So you mentioned before that anxiety doesn't end with delivery, and if you have a healthy baby, you can, your parents learn to function and navigate new things to worry about. How do they deal with that?
Yeah. So that's a discussion I have with people in pregnancy. If they're a particularly anxious person, it doesn't end when the baby comes out.
And I think that's important for people to realize. Our personalities have a lot to do with it too.
Yes.
And so if we know that about ourselves, then we need probably more support around ourselves.
Yeah. Yep. And I know we have excellent resources, people who specialize in prenatal counseling. So just counselors in this particular area of life. And so I would encourage people to go see someone to create strategies for coping with their anxiety before they have a baby.
Good advice. Okay. What role does sleep or lack of sleep, we've talked a little bit about this, play in postpartum mental health.
Yeah, it is a big factor, you know. So when I'm talking with people too, and they're having a particularly rough go, one of the questions we ask is if I have a day of sleep and I wake up and I've slept better, does my outlook improve?
Right.
And if the answer is yes, that's a good sign that this is a bit circumstantial. And as we start to get a bit more sleep, we're going to be in an okay place.
Yeah, good to know. And here's another big topic, co-sleeping. What are the pros, the cons, and safety considerations that parents need to think about co-sleeping?
Yes. So I do get asked this question a lot.
Okay.
And we know there is large benefit to having a baby in a room with you. So you as a couple need to decide what you are comfortable with. There are absolutely safe strategies. So if you decide to have your baby in your bed, you should not be using alcohol or tobacco products. That will impact your ability to be mindful of where your baby is. No large duvet covers, anything like that.
Right.
And we really want to do it in a safe way. So truly, the Pediatric Society would suggest not having your baby in your bed. So if you're going to do it, make sure you're using those safety parameters. And a bassinet beside the bed or kind of bed extenders are great options to have your baby right there if you need, but maybe not under the covers with you.
Oh, that is good. Well, we're wrapping this up. Is there one last thing within the 15 seconds that we should think about?
I would just say, you know, like we've covered so much, and there's so much more to hear.
Yeah.
So if you've thought of something, I encourage you to go read about it, ask your care provider about it. We're happy to discuss these things with you.
Wonderful. Thank you so much for coming.
Thank you so much.
Such good information.
Yeah.
The postpartum season can be exhausting, emotional, and unpredictable, but it's also a time of incredible growth, bonding, and joy. Knowing what's normal, when to ask for help, and how to support yourself along the way can make a huge difference. We hope you found this conversation helpful. Thanks for joining us on A Healthy Dose.